Now let's have a look at the screening procedure itself. The examination begins even before the patient is seated. As she comes into the room, we look at the face and the neck, checking for symmetry or for any obvious lumps and bumps that shouldn't be there. Can you please take a seat? We look at the face from the front and check the neck. We ask the patient to move the head from side to side. This stretches the skin over the cervical lymph chains and can make them more obvious. Could you just sit forwards? And we do the same from the back, again asking the patient to move her head from side to side, because some nodes may be easier to see from this position. And just pop your head back again. Then we come on to the intraoral examination. We're going to move around the mouth systematically, checking each surface at a time. In order to do this, we need a good light source and some magnification. As I audibly call out the surfaces that we're looking at, my nurse will be checking them off on a checklist, which acts as an aide-memoire. I'm going to look around the mouth systematically, visually examining all the surfaces and palpating the floor of the mouth and the sides of the tongue to check for normal texture. But it's important to remember that when we're holding instruments to keep the cheeks away, we need to move the instruments themselves and have a look underneath, because some lesions may have been obscured. When the intraoral examination is complete, we move on to palpation of the major lymph glands and the major salivary glands. We start by feeling underneath the mandible, and then moving down the sides of the neck, right down to the collarbone. We can also check the parotid glands to make sure they're in normal texture and roughly even in size. And we check the skin of the face carefully as well to look for any spots or blemishes. And it's important here to remember that some patients will try and hide these blemishes with makeup. So if we suspect something's concealed, we ask the patient to remove the makeup.